Fentanyl withdrawal timelines can be particularly difficult to establish due to the multiple illicit forms in which the drug appears. These non-pharmaceutical varieties, laced with illicit drugs such as heroin, inject the withdrawal process with an element of uncertainty. In general, early-stage withdrawal effects may be experienced in as few as 3 or 4 hours following dosage. Peak symptoms typically appear within 1 to 2 days and subside within a week or two in most cases. After enduring the initial acute withdrawal stage, a client in early recovery from fentanyl transitions to a longer, less intense phase known as post-acute withdrawal symptom, pause. Depending upon the intensity and duration of their fentanyl addiction, pause may affect users for months or even years. In rare instances, permanent damage is sustained as a result of the potent and unpredictable drug's interaction with individual biochemistry. One of the primary goals of fentanyl detox is to minimize or prevent precipitated withdrawal, the rapid and potentially dangerous acceleration of withdrawal symptoms. Fentanyl may be undetectable by urine under certain circumstances, but in designated tests it may appear for up to 24 hours. Saliva tests generally detect the drug for a period of 1 to 3 days, less than other opiates. Fentanyl is relatively short-lived in the bloodstream, with a maximum duration of approximately 12 hours. Hair samples provide the most accurate long-term result, with traces appearing for up to 90 days following dosage.
Even in small quantities, the presence of fentanyl can be extremely dangerous, even fatal. Every day, more than 150 individuals lose their lives due to overdoses involving synthetic opioids like fentanyl. What makes it particularly perilous is that fentanyl can be present in drugs at lethal levels without any visible taste or smell cues to alert the user. Fentanyl is a synthetic opioid that surpasses heroin in strength by up to 50 times and morphine by up to 100 times. Its potency makes it a significant contributor to both fatal and non-fatal overdose cases in the United States. There are two primary forms of fentanyl, pharmaceutical fentanyl and illicitly manufactured fentanyl. Both fall under the category of synthetic opioids. Pharmaceutical fentanyl is legitimately prescribed by medical professionals to alleviate severe pain, especially post-surgery or for individuals with advanced stage cancer. However, the majority of recent fentanyl-related overdoses can be traced back to illicitly manufactured fentanyl, which is distributed through illegal drug markets due to its heroin-like effects. Illicit fentanyl is frequently mixed with other drugs due to its exceptional potency, resulting in more affordable, stronger, more addictive, and ultimately more hazardous substances. Fentanyl was first developed in 1959 and introduced in the 1960s as an intravenous anesthetic. It is legally manufactured and distributed in the United States. Licit fentanyl pharmaceutical products are diverted via theft, fraudulent prescriptions, and illicit distribution by patients, physicians, nurses, physician assistants, nurse practitioners, and pharmacists. From 2011 through 2021, both fatal overdoses associated with abuse of clandestinely produced fentanyl and fentanyl analogs, and law enforcement encounters increased markedly. According to the Centers for Disease Control and Prevention, CDC, overdose deaths involving synthetic opioids, excluding methadone, were involved in roughly 2,600 drug overdose deaths each year in 2011 and 2012, but from 2013 through 2021, the number of drug overdose deaths involving synthetic opioids, excluding methadone, increased dramatically each year, to more than 68,000 in 2021. The total number of overdose deaths for this category was greater than 258,000 for 2013 through 2021. These overdose deaths involving synthetic opioids is primarily driven by illicitly manufactured fentanyl, including fentanyl analogs. Consistent with overdose death data, the trafficking, distribution, and abuse of illicitly produced fentanyl and fentanyl analogs positively correlates with the associated dramatic increase in overdose fatalities. What does it look like? Clandestinely produced fentanyl is encountered either as a powder or in fake tablets and is sold alone or in combination with other drugs such as heroin or cocaine. Fentanyl pharmaceutical products are currently available in the following dosage forms: oral transmucosal lozenges commonly referred to as fentanyl lollipops, Actic registered, effervescent buccal tablets, Fentora registered, sublingual tablets, Adstral registered, sublingual sprays, Subzees registered, nasal sprays, Lizanda